Hello, good morning, buenos días a todas y todos. I'm thrilled to be here. First, because this is an event, it's a small presential event, most of it happens online. But most of all, because we have an amazing panel of the top experts in association events in Europe. And we got a wonderful topic which could be transformative for our industry, I believe, which is the concept of legacy. And these professionals are going to explain us everything about this. We're going to have a two-part event. The first part is in English, and it's related to the opinions of these four big association medical societies about the concept of legacy. This will be about 45 minutes. It will be in English. And then the second part will be in Spanish, and it's going to be about how concretely these concepts are translated in a concrete case, which is ESTRO bringing its congress, its 2021 congress to Madrid in late August of this year. And as you probably know, the ESTRO congress was built especially thinking about what legacy it can leave to the destination. We're going to go to the debate. I want to first thank everybody who made this possible. We're in the wonderful, amazingly equipped Melia Castilla hotel in Madrid, a perfect hotel for big congresses. We're in a 600 people auditorium. We're about 10 people, so I guess distance-wise, we're probably safe. We have the audiovisual of Hotec, which is a JV of Fluche and Crembo dedicated to the hotel industry. We'll go back to understanding who this dream team is. We have the registration system of Meet Maps, and we got the connectivity solutions of Watchity. And most of all, we got 27 heroes of Evento Plus who have been working to make this possible. So thanks to all these specialists and thanks to the dream team of Evento Plus. We have a deep topic. We have limited time. We're going to try to go as much to the point as possible. I'm going to introduce our international participants. We got Alessandro Cortese, the CEO of the European Society of Radiotherapy and Oncology, who's probably the guilty party for all this. I thank him for this. We got Isabelle Bardinet, the director of the European Society of Cardiology. We got Oliver Wykes, the COO of the association Wind Europe, related to wind energy. And we got Pippa Powell, the director of the European Lung Foundation, which works with the European Respiratory Society. So thanks a lot to them. Not much more introduction. Let's cut to the chase. I'm going to ask our participants something extremely difficult, which is to give in 3 minutes a brief definition of how they understand legacy and the key highlights of one example of legacy that they have applied or they will apply in one of their events. This is something like summarizing the Bible in 3 minutes, but I'm sure they're going to do a great job. I'm going to start with Alessandro. What is this? What is legacy, Alessandro? And how do you apply it?
Good morning, and thanks for the very direct question. So I'm not sure I want to call it legacy. I like impact maybe a little better because legacy is something that stays behind after, as opposed to a continuous process. So when we speak about impact or legacy, in our case, it's about patients. It's about the ultimate beneficiaries of what we do. So of course we serve a medical community, radiation oncologists in our case, who treat cancer patients. So for us, impact is what we can do in order to improve the outcome for the patients. What we can do to serve our members and our community in a way that will increase the outcome. How we measure outcome is basically by measuring how patients are treated and comparing what should happen if you apply the protocols and science as it's supposed to be and what really happens in the hospitals. We try to understand what are the barriers that create the gap between the optimal case and the actual case. And then basically the strategy of the society is aiming at tackling those barriers. So an event is a big catalyzer. You have all the stakeholders of the community there. You have a long process around the event because of course by the time you decide where to go, the destination, you start planning for things, you have 3, 4, 5 years sometimes. So you can look at things in a long term, be quite direct in measuring this gap at the beginning, work with the expert local community who knows the situation better than we do coming from an international perspective, plan for actions over 2, 3, 4, 5 years, and then remeasure at the end and see if the situation for the patients has improved. So an example would be now coming to Madrid and coming to the Spanish context. An idea is to understand whether the level of staffing is adapted to the level of the equipment in the country. And for instance, trying to do actions to see whether you can create more vocational training in medical schools to attract potential, let's say, talents into radiation oncology, and then from there have an impact on the level of staffing. That would be one example, but of course many others are possible.
Wonderful. 2.5 minutes, and you've summarized it. Just to make it very concrete, I understand that you say, for instance, do we have enough equipment? Do we have enough talent? Do we have enough culture of acceptance of radiotherapy? And then you throw the gauntlet at the local destination, saying, okay, how can we raise awareness or investment, and let them act on the drivers that they can add on, that they can work on? Is that correct?
Yeah, that's correct. So in essence, you have barriers that link to supply and barriers that link to demand. So supply is quite simple. It's quite obvious. Do you have the right resources? Do you have the right equipment? Do you have the right level of staffing and so on? And demand is do patients, are patients aware of the opportunities with a specific treatment, or are other medical professionals referring patients to the right treatment when it's the case? And so this is really the 4 main blocks. We provide this framework to the local community, and we ask them to interpret it and to give us the understanding of it and how the different elements interplay in a local environment. And of course, healthcare is a national or a regional matter. So local knowledge is essential, because what is true in a specific context may not be true or not equally true in another area. So let's say impact and legacy are maybe it's an approach that can be consistent, but at the same time it has to be really adaptive to the local reality.
Perfect. Wonderful. Isabelle, in the case of cardiology, is it different?
Well, it is a little bit, because one of our main objectives is that the public should not become a patient. And so one of our main drivers for impact is to get people to realize that they can be an actor in not becoming a patient. And here we want the cities to be part of that. And so we created a heart health charter, which is practically impossible to pronounce for anybody who's not English. And we get the cities to sign up to the heart health charter, where they will encourage the people that they are in charge of, their local citizens, of actually moving. And we went one step further in London, where we not only had the Heart Health Charter, but we created a heart trail in the city so that people could follow the heart trail running or walking, and at regular intervals there would be messages explaining how to avoid becoming a cardiovascular patient. Because obviously this is really where we want to have an impact or have a legacy. I prefer impact. Legacy sounds a bit slightly pompous, if I may. And what we want is to actually have an impact and change things.
So I have to organize another webinar on impact, because this one is titled legacy. Just one compliment. Something Alessandro commented is the importance of time. Do you also track results in the years after the Congress?
Not sufficiently, and I think Alexandro is definitely a trendsetter here. It's perhaps a little bit more complicated for us because when you start talking about the public and prevention, the actual measurement is quite difficult and would be probably at the level of a complete generation. So it's not that easy to actually measure it in that way. The important thing is to get the ball rolling, because I think that is fundamental.
Wonderful. Pipa, you are quite a trendsetter too, because you won an ICA award for a wonderful awareness raising campaign, I believe in Madrid in 2019. Can you tell us your definition and what you do in terms of legacy?
Yeah, for sure. Morning, everyone. So we're very similar to Isabel and the cardiologists in that prevention is really the key of what we do. I mean, actually, we started a long time ago in 2000, bringing sort of outreach from our congress. So I work for the European Lung Foundation, just to set the scene, and we communicate with public and the patients on behalf of the European Respiratory Society, who communicate obviously with healthcare professionals, lung health. So back in 2000, we started reaching out when the Congress came to different cities, offering free lung function testing to find people with disease. And that was completely unsexy. Are you coughing? Do you have sputum? Come along, come and have your lungs tested. So in 2014, we tried to rethink this very much along the lines of Isabel. You know, it's about prevention. For us, it's about not having people with COPD, convincing people not to smoke, explaining the importance of clean air, getting them to be active, and now also vaccination. So saying these are the 4 key factors you need to understand in order to prevent lung disease. So we still do the same thing. It's focused around having your lungs tested and using that as a catalyst to educate people about ways that they can keep their lungs healthy. And I completely agree with Alessandro that this has to be done over a really long time period, and it has to be done with the local partners. So for us, local patient organisations, local medical societies, but also the city, the Convention Bureau, and other NGOs. We need to know what the city cares about, what it's doing already, how we can plug into that, amplify it, or you know, give a media boost to it while we're there. And we also need to know there's people who are going to continue doing this when we leave, so that it's not just a one-hit wonder and then we're gone. So for me, legacy is really about finding the topics that are of key importance to the place where we're coming, making sure that what we do fits in, that we work together with those players, and that whatever we initiate, catalyse, kickstart continues once we've gone. Now, we are the same as Isabel again. It's nigh on impossible to measure. We started in Madrid actually asking people after the event, you know, what are you going to change about your life? Are you going to quit smoking? Are you going to be physically active? But, you know, we don't have their numbers to phone them back up and find out whether they have. I mean, our dream would be able to say the population's lung health has improved since we went to the city, but I think that's probably a big ambition that we'll never achieve. But yeah, for us, it's about educating the public about how they can keep their lungs healthy, finding ways that we can fit into the current agenda and making sure that continues once we leave.
So your legacy project would be different in different cities, because I believe that some are more polluted than others, some have more culture of sports than others. It is tailor-made, or do you
yeah,
go
absolutely.
And
so that's our first point, is let's sit with the Convention Bureau, let's meet people from the city, let's talk to our national organisations. What do you think the key topic? So for example, in Milan it was smoking, and in Paris as well, but actually in London it was air quality, and Madrid it was air quality, because there'd just been a change of local government and we knew there was issues with the air quality zone. So it really has to fit into the local context and either be sort of a bit of a driver pushing change where there isn't change, or fitting into things that are already happening and just giving them a bit more strength.
Wonderful. We go to Oliver. So not healthcare, but still extremely important for our future, wind energy. What is your understanding, what's your definition and your actions related to impact, not legacy?
Good morning. Yes, thank you. So we're indeed the voice of the wind energy sector in Europe. So basically, we work to have the right policy and regulatory frameworks in place for the development of wind energy. And we were actually introduced to the legacy concept by the city of Copenhagen. and they actually introduced us as one of their pilot cases for the legacy project for our next annual event, which is taking place in November. And here we understand legacy as a means of creating closer connections and greater interaction between the Congress and the host community. So it is indeed about maximizing long-term and long-lasting impacts, but it's really about broadening the scope of the stakeholders that we're interacting with. And that very much is in line with the current frame or the current state of work for the industry, where we're now 16% of Europe's electricity, and we're going to have to play a very important role in the energy transition. And so we, within these legacy discussion, structured the structure of the legacy initiatives around three main dimensions: people and society, research and education, and business. And for people and society, to give an example, we work with the Danish Energy Agency to set up an intergovernmental forum to bring about high-level or medium-level policymakers from around the world to exchange best practices on, deploying wind in the respective countries. On research and education, we worked with the Danish Technical University to bring about students for them to get jobs, internships, to inspire them to choose to work for wind. And then on the business side, we work with local incubators. We also work with innovation and energy clusters to develop an innovation hall with startups and to create really meaningful business delegations.
Okay, wonderful. Legacy impact could be misunderstood with CSR. Is it just a matter of degree, that legacy is more long-lasting and involves more players? Is it a matter of degree, or is it the same? What would you say the difference is between legacy and CSR? I will throw the gauntlet at Pippa.
Well, thanks for that simple question. So in my perspective, I think they're very closely related. So I think from our idea, CSR is reaching out from the Congress Centre, seeing beyond the walls of the Congress and reaching out to the citizens in the city and the country as far as you can. For legacy, I would say it has to have a lasting effect. So as you say, it might not be something you're doing specifically, but it's going to be the catalyst or the starting point for something that's going to continue once you leave. So I think that's the big thing. If we came into a city, and we have done this before, just done an event without engaging with the local players, then that is just CSR. That's, we're here, we're ERS, ELF, and we're coming and doing your lung function testing. But it's the engagement of people locally and making it into a project that everybody's engaged in and dedicated to that makes the big difference.
Okay. Okay, wonderful. How important, one about what kind of local resources you need and what kind of local impact you need. I understand from your interventions that awareness raising among patients or potential patients is obviously always on the agenda. I believe it can go much further than this. How far can it go? Especially, does it go to investment? Does it involve local companies? I believe that for wind energy, it probably does become an economic factor as well as a regulatory or awareness-raising one. But do you think stimulating new companies, new research, maybe investment, maybe creation of research centers. Do you think it will go? Do you think it will go that far? Who takes this? Isabelle, I'm afraid I have to ask you this question. Does it go beyond awareness raising among patients?
Probably, but it's not directly managed by us. I think that we're that piece that opens doors, but we don't actually manage the next steps, which are the research investments, which are the creation of new companies. We do have, and we've had for some time now, an area where we encourage startups or big grants from big organizations in the case of research to come to the Congress and to try and get in touch with the bigger pharma or the bigger healthcare industry. But I don't think that's really our responsibility. I think it is something that we actually provoke, but we're not actually managing it. Our members are healthcare professionals. They're doctors. 80% of them are clinical cardiologists. So they deal with patients. So fundamentally, our focus is on how can the most people get the best treatment easily and accessibly. And that is a big problem. And so our focus on that, whether it's corporate social responsibility, where by nature a doctor is practically corporate social responsibility himself, is to try and get people to be part of our team against cardiovascular disease. So we really try and reach out to get people on board. So probably to continue with Pippa's comment, I think that CSI is very much a company or an organization reaching out, whereas legacy is us trying to get people in. So it's completely a different thing altogether. And so we do try, we've invested in information in particular for children, because frequently cities have the responsibility of preschool children. And it's at that moment that they start eating a whole lot of rubbish that's going to bring them to the cardiologist quite rapidly. So we've developed information, we've developed different things to be distributed to teachers of preschool and to be distributed. So what sort of economic impact does that have? I don't know. I hope it means that those children will not see a cardiologist in 18 years from now, basically.
Okay. Oliver, in your case, bringing your congress to a city results in new investments after the congress? This is a question which is a bit of a bridge towards the corporate world beyond the healthcare. Does it?
I mean, yeah, it definitely can. And there are big investments that are even being made at the event. We used, well, in the past, we were, or our main stakeholders were holding off for the event in order to make a big launch or to make a big announcement at the event. Now it's moving so fast, they can't really allow themselves to do so. But it's really very much dependent on the current market, local market states. It's also very much dependent on the political states. And we've seen markets which were very potent, which became all of a sudden very flat because of the political change, and vice versa. A market which was flat became all of a sudden very potent. And when you have these long lead times to work with around events, this is something that we really need to work with and work towards, because the market is evolving very, very quickly. We're in a market which is very M&A intensive, with a very high consolidation, and it's very difficult to operate and to ensure that we will have, you know, the investments that we're looking for by creating the momentum in being the event there. Yeah, but having an investment is one of the outcomes, but our events are our main platform for us to really advocate our positions and put forward the relevant messages that are needed both locally but at European level. And what we do in order to do that is we issue a flagship report to push our positions, bringing about meaningful outcomes.
Okay, very briefly, the event in itself is necessary for that, because you could imagine that any action of awareness raising or of press relations could be done without the event. Your experience is that when an event comes, it is an event. It is something that's noticeable, and so it makes all this legacy impact work much easier.
Yes, and it's a great platform because you can bring about all the policymakers, the high-level stakeholders and industry representatives in the same room and push forward the relevant messages and bringing these high-level these energy ministers or European institution stakeholders to a 10,000 square meter exhibition also gives them a breadth of what the industry is about. And sometimes it's just about this to make them realize what we're talking about. And if you join that with a relevant study and a noteworthy message, then the event is really the greatest platform to do that.
Staging the industry is still very important. A very brief question to all four of you. How important is it? Is it strategic? And to make it very concrete, could it make you choose a city where maybe attendance would be lower or profitability would be lower, but you would meet that mission? If it's a nice to have, then you wouldn't sacrifice anything. If it's a must have, then you could sacrifice a bit of attendance or a bit of profitability. How far are you going to walk the talk? I will go to Alessandro, and I will also ask him a question that legally I have to ask him, which is how good does the event in Madrid look? Everybody is looking for, is it how safe are the events for the rest of the year? So we need good news, Alessandro. So 2 questions.
Right. I go in order by question. So how strategic it is. So we made quite some buzz during our last round of RFPs for select destinations because we actually included the impact or legacy, as we call it today, component into the RFP, and we weighted it for 60% of the total evaluation of the bid we were receiving. So it was a sort of Troy horse idea to hack the system to make sure that at RFP level, which is the moment where basically we can impact on how people think about attracting an event, well, legacy then would be part of the plan, and we would get replies that would involve the local communities from that moment, as opposed to have a typical reply that comes to destination based about heuristic aspects and other elements that are more linked to the ease of doing business, but not necessarily to the strategy of the event. So maybe that you can also have the side of the story from the Madrid experience later on this morning. But we really saw that it was a differentiator, and for us, it also allowed to have a longer term planning because when I was referring to those 4 blocks that create the barriers, and we know that they don't interplay in a similar way in different places, well, we had a strategy behind that was also to try our approach in 3 types of countries where those barriers will not play in the same way. So by selecting Madrid and Spain, we know we go to a case that is similar to a certain number of countries. By going to Copenhagen next year in 22, then we know it's a totally different scenario and the barriers there play in a different way. So the objectives are different and the game is different. So that's somehow the strategy. So yeah, it's really strategic. And I would say also to make a link to the previous question about CSR, I think maybe the difference between CSR and what we do is that for us, this is maybe not even on the level of strategy, it's on the level of mission and vision. It's really how we try to make a difference and how we try to embody the raison d'être of the organization and its outcomes. So CSR, if you want, it's a strategy diversification, while impact and legacy should really be at the core of why you exist at the end. Madrid 21. So what I tell to the board right now is that they will have to welcome my dead body if they try to cancel the meeting and go digital. So and the news for the moment are not discouraging, let's say like this. And so I'm confident that we will be able to have a meeting, but where there will be a live component. It's going to be a blended event, so we will need to allow also people to participate digitally. But we look at certainly pushing as much as possible the idea of having the faculty on site, so the speakers and so on, and to allow the participation to choose between a live and a digital format. I have news right now. So at 12 today, we have the deadline of the abstract submission. That for us is a big moment, because from there we can extrapolate a lot of things. And so this morning at 9, we were above the number of abstracts that we had in the last full meeting. So that was 2 years ago, which is meaning that people are desperate to come back to live event. This is a most concrete sign. So I think we would be now only playing it safe psychologically to jump to digitalizing things today, but we would probably not meet with the real demand that is coming from the members and the community that wants to meet. But of course, we need to do it with all the rules about safety and the regulations and the protocols, and allow people to do what they feel comfortable to do. So to travel if they can and want, but also to participate digitally if that's the preference they have now.
Okay, you told me a few weeks ago that vaccination is going to be applied especially to people in the healthcare industry, so, or in the healthcare professionals. So this should facilitate.
Yeah, so it's also it's news from yesterday from a major medical agency in the US that they're allowing again gatherings in closed space for people who had 2 shots of vaccination without masks, without social distancing. So voilà, so maybe we're more careful than the Americans are on a few things. I don't know, but what is clear is that there is now momentum that is being created around different tools also to allow traveling, like vaccination passports, and the protocols are becoming more can I say, consolidated about things. So yeah, no, I'm really quite positive that by the time we're planning the event, which is the last week of August, it's going to be possible to be in a conference center. Yeah, it's true that the medical population is in the first round of vaccination, so the herd effect probably locally will be there. But by that time, probably it's going to be also a much larger share of the population that will be vaccinated.
You know, this is the only reason why I organize this webinar, to get you to give us good news. The rest, how strategic is it? Alessandro said a figure of 60%, I believe, in the selection criteria. With a number or without a number, does it justify maybe a sacrifice on other parts of the Congress? Is it that important, or is it something that you just try to add to a Congress that has to be perfect in other aspects? Who takes this? Isabel. And then Oliver.
Yeah, the ESC Congress, well, at least up until 2019, was at a size where the choice of destinations was not very big. So bringing in this factor would probably have eliminated the few cities we had left. So I'm afraid it cannot weigh in the same way that it does for ESTRO. Oh, nevertheless, yeah, we do have other congresses which are not of that size, where at least the partnership and the desire and the capacity for the destination to be a partner is one of the major factors for decision. Now, does it go as far as legacy? Probably not as much as it would for the ESC Congress, where the general impact on the size of it means that there's a lot more visibility. So I don't think we can answer that question with a simple yes or no, because the size of the ESC Congress or even the ERS Congress mean that we don't have that choice.
It's like
so that's a different point of view, really.
Is the problem of hosting a 35,000 people event or something like this?
Yeah, that's right.
Okay, Pipa Oliver was raising his hand.
Yeah, so for us, it's definitely plays a large role in our strategy to choose a location. That's for sure. I don't think, though, that it automatically leads to a compromise, because if you want to build legacy, you need to bring value for all the stakeholders that are involved. And I think if you have that, well, probably the stakeholders are going to, involve resource, time, energy, and sometimes money in order to bring about the event. So I think you'll have, a good frame to have the event. So I'm not sure it automatically leads to a compromise.
Okay. Anything else, Pippa?
Yeah, I mean, I can echo what Isabel says about size. I mean, we're limited. So in fact, our problem was going back to the same cities and actually do we do the same thing again? Will that have more impact and more legacy? Or actually, do we need to find a way to reach other people in other cities that might need us even more? So what we've now started to do is provide grants for people to hold events in their own community. So this is another way that we can really stimulate legacy, is having an event at the Congress that inspires the members and the attendees to then go back to their own communities, their own cities, their own countries, and do the same thing. So we're kind of now at that stage that how can we amplify it to places that we don't directly reach? And I think that's another important factor, particularly in this new digital era. How can we impact post-Congress, not necessarily physically, but in other ways?
Okay. We'll see how much time we have. I've got at least two more very important questions. One is, how important is it for our industry? I'm going to throw the gauntlet at Alessandro. Are we an industry which should take more into account the needs and the missions of people like you, who are the most important people in the industry because you make everything happen? And could legacy be a way to make this transition? And do we need a new way of understanding our key stakeholder, the first stakeholder, which is the client, which is you? The second one will be, what do you need from local players? And do you get it? You get it in Madrid, I'm sure, but how much do you get it? Alessandro, could this be transformative for our industry? Is there something that we need to change in how we understand people like you? Make us suffer, give us a hard time, come on.
I was about to say I should be careful not to sound too negative now and too critical, but if you allow me to be provocative, then
we need to improve.
Yeah, so I think the industry, I mean, if the industry is thinking that the pandemic is the worst thing that happened to it in the last years, I think it's up for a big surprise, a negative one, which is the fact, in my opinion, that, well, the industry is based on what? Is based on business interactions and people traveling free around countries for facilitating the business interactions. And, well, it's about the same mechanism of spread of the pandemic, no? It's concentration of people in cities at a certain time, and then people flying around and then going back, and voila. And this in a climate where, since a lot of time, there are discussions about the impact on sustainability with traveling and so on. So I think we have to face the consequence that the storytelling that we had before about the justification of this industry and meetings and events and congresses is not going to be sufficient anymore in the future to justify why this thing has to continue and why it's making a difference and a positive impact. So what we are discussing today is, in my opinion, fundamental, because if we don't step up to that level of articulating the value and the vision of the industry, and again, I'm saying the industry now, not a single society, organization, association, and so on, well, then we're failing to create the arguments for an exception. Maybe it's not the right word, but anyway, we'll have a hard time to justify why this word that we knew before is still making sense, and on the contrary, is a very good idea. So yeah, again, it's not to sound very negative, but I think this is very, very important, and it's the right time to do it. We also have to face the consequence, and I'm going to be also maybe a little too harsh, but what is going on now with all the digitalization of events is, of course, a necessary patch, and it allows many of us to continue going for the time being. But it is also something that is at the core of what we do in a negative sense, because what we do is really to allow those communities to be working together, interacting, exchanges, and so on. So the more we think that the digitalization is going on now, which, by the way, for me is not a real deep digitalization, is more becoming paperless on things that would not touch really on the value of what we do. well, the more we do that without having in mind how to return into the community-centric approach that we had before, well, the more we're creating harm to our organization in the long term. So the two combined, I think we really need now to be very vocal about this, have good cases, have organizations that embrace into this, have a very high level of understanding amongst ourselves and the destinations. And therefore, it's not possible anymore, in my opinion, to just go to a destination and say, hey, we have a meeting, by the way, can we do something about impact and legacy? It has to be a shared vision. It has to be a shared planned approach where from the beginning, we know what we're trying to achieve and we need to find a common goal with all the local stakeholders so that from both sides, this is part of the design from the very beginning of the idea of an event.
I am healthy. I'll take some water in a while. Other participants, do you agree? Do you think we need a change of understanding of the needs of societies and of the role of events in associations like yours and in society? If we're only here to sell to you hotel rooms, then maybe we're not understanding, we're not doing something very sustainable. What's your point of view on this?
Well, if I may, I think that the point Alessandro has made is extremely important. I've been in the meetings industry for longer than I would like to admit. And for the first time, I think that something here is changing fundamentally. And if the meetings industry don't wake up to this, I fear that a number of them will not be here in a year or two. And I think that they really do need to think about it. Destinations need to rethink, why would we come and how can they partner? And it is not indeed just selling hotel rooms and coffee cups. It is, what is all this about? And why is it so important? And some destinations, honestly, I think we really are going in for a very, very big shock. And also, I think that some of the actors of the meetings industry are changing. Where there were booth builders, there will be people who create online platforms and who currently are not considered as part of the meetings industry. So there are going to be new actors and they're going to shake things up enormously. But we must not lose sight of why do we do this? And all of this is just a way of doing it. And if some of the ways or medias are going to change, we'll just take them on board and use them. But the fundamental way that an association, and particularly a medical association, is going to function is how can we fulfill our mission? And whatever is available, we will use. And if that means using gaming platforms or if it means using other things, we will. But there is one thing that will remain always, always, is that people want to meet. And that is fundamental, and it's part of what we owe our members. So the destinations have, those who are going to wake up to this, a fantastic new opportunity of being a partner. Either they take it or they lose it.
Wow. I like it. We need to hear that. Maybe we're an industry obsessed with selling you hotel rooms rather than getting you to fulfill your mission. Pippa, Oliver, is there any difference with what was said until now? Pippa is raising her hand, I believe.
Yeah, no, I completely agree with Alessandro and Isabel. It's about a partnership. I mean, that's the key word I pulled out of what they both said. And, you know, I can only talk anecdotally and retrospectively, is that the cities where we've come, where they've engaged, they've brought into that mission and vision, it's just been a completely different experience. And the impact has been huge in comparison. You know, where they just see it as a tick box that they have to try and get us connections to certain places, it's completely different. So absolutely, it's a partnership, and that's going to make the big difference in the future. So yeah, I agree with both of them.
So I'm not sure for Oliver or for whoever. taking gaming platforms just as an example, because I believe it is, you find destinations are very good at putting you in contact with convention centers and hotels, but need to broaden a bit the types of local players that they help you with. It could be online players, it could be NGOs, it could be the press. What do you need from destinations that you're not necessarily getting today? We can start with Oliver, but anybody can give their opinion.
So we definitely need a more integrated approach, and I think it's really about the Convention Bureau playing a facilitator role by not just establishing meaningful connections, but also identifying meaningful connections, because they know what locally could be leveraged. So I think they need to get more into the content and to understanding the mission of the organizers, right? And then you can create a well-knitted array of stakeholders in order to bring about the most value. So definitely, I think the role needs to change dramatically, actually. But I think to be a bit less dramatic, some destinations are very much already in that perspective and in that position. But I do agree with Isabel. There are some venues or some locations which will take a hard hit if they don't change their approach.
All other participants, what do you need? Your laundry list could be access to politicians, access to press, access to NGOs, access to companies, schools. What do you need and what do you get? It's your time to ask.
Yeah, yes to all of that, Eric. I mean, Isabel's absolutely right. Schools are a key target for us, you know, and you know, there's something for us as well. I mean, from a medical perspective, you know, cardiology and you know, ERS and our mission vision, it's the same topics and it's the same messages. So actually, could the cities and the convention bureaus help us to find a way that when we come and we're repeating the same messages, actually we build on what we've done before, rather than coming with a new campaign and a new message. So politicians, absolutely, you know, in Paris, we met the mayor of Paris, who'd done lots of activities on clean air. That was hugely impactful. In London, you know, we partnered again with the mayor there. So politics, schools, companies, that's something else that would be fantastic from our perspective, is actually if we want to have a really big impact, can you find us companies with similar missions, visions, aims that will help, you know, increase the size of our impact and take us down new avenues. So yeah, all of that plus more.
All of that,
please.
Isabel, Alessandro, anything you need, and overall, do you get it? I believe that Madrid has done a wonderful job to get Estro to come here. In general, do you get the support you need, and most of all, the access to, I believe, a lot of players which are not in the meetings industry permanently, which are just intervening specifically for an event. Do you get access to that?
Not always.
Not always.
Not always. And I think that this is where there are huge differences between cities who have taken this on and cities, and I'm sorry, I'm going to be like Alessandra, a bit provocative, where convention bureaus are basically the front of the hotel industry and are absolutely not interested in anything else. There are massive differences. When you see the mayor of a city, and we had exactly the same experience as Pippa with Paris and with London, when you actually get the mayors who said, I want to be part of this, I want to do something, whether they're piggybacking on it or not is a different issue, and it doesn't matter as long as we get what we're looking for, which is access to the channels of communication to a massive number of people. This is very, very important. But there are cities who are still, and the convention bureaus need to wake up, who are still trying to sell the usual place for the gala dinner when we don't have gala dinners and haven't had them for years, or how many hotel rooms and the prices go up, etc. So yes, there is, and you can see already, two categories of destinations, and those who are coming in as a destination and those who are coming in as a small corner shop.
Wow, great. I'm just going to quote Alessandro. There's an interview we're going to publish shortly, and you were telling me something, which is that a lot of, and this is the last questions. We are late, and we got Dr. Contreras waiting to come in and explain Estro Madrid. You were saying that there's a problem with a lot of convention bureaus considering themselves part of tourism, being in organization terms in tourism, and you were giving me that sentence, which is an amazing wake-up call, which is that if as an industry we just want to sell hotel rooms, then we are not going to sell them. The best way to sell hotel rooms tomorrow is to get away from the obsession of logistics and to go deep into understanding your mission. Can you comment on that?
Yeah, sure. Should be careful of what I say in interviews. That's the first thing I should say. Then the second is that, yeah, I completely agree. So, well, it's a very, very easy statement. There is an association for everything, right? So there's a number of associations that is huge. So I cannot believe that in a city you have a strategy that taps into all the sectors of all economics and all society and so on. Each city is different. Each city should have a strategy of development, socioeconomical development, that focuses on some sectors. There should be an investment plan behind that is already happening. There should be, let's say, a structure and an infrastructure to support that. So there, then we can see whether we can play a role, we can tap into that system and accelerate and enhance the system, really make an impact. So the Convention Bureau in that system cannot be a touristic agency. It's our primary interface to tap into a socio-economical strategy. If the Convention Bureau is not positioned like that in a destination, then, well, it's going to be very hard to trigger all the process.
Okay, don't worry, Alessandro. When you say something about a whole group having to improve, nobody considers that it's for them. Everybody says you're talking about other people, so nobody will hate you. We unfortunately have to stop. If there's a last declaration, you can raise your hand. If not, we'll switch to Spanish. And I cannot thank you warmly enough. Our industry desperately needs legacy or impact, and desperately needs stakeholders like you telling us some home truths, because it's the only way to be more relevant tomorrow. So Alessandro, Pipa, Isabel, and Oliver, the warmest of the thank yous, and I hope we have an opportunity to organize another one, because there's so many things that we couldn't cover. But thank you, and have a good congress in Madrid, Alessandro. And to the others, keep up posted about your legacy efforts or your impact efforts. And thank you for making the meetings world a bit better.
Thank you.
Thank you.
Thank you. Bye-bye. I'm going to now put on my mask, switch to Spanish, and invite Natalia Carballo and David Noack. Y paso al castellano. El doctor Jorge Contreras está conectado. No le veo, pero en técnica seguro que se hará. Entonces vamos a ver ahora. Primero, gracias y gracias por estar aquí, por formar parte de este movimiento que hemos visto con estas sociedades médicas y asociaciones. Ahora me interesa saber cómo se ha hecho en Madrid. Entiendo que tienes un papel importante en definir, en hacer el próximo paso después de lo que ha comentado Alessandro, que os dice, estos son las palancas que tenemos que tocar. Ahora, moverlo en Madrid. ¿Cómo ha sido este proceso? ¿Cuándo habéis empezado a trabajar con el Convention Bureau? Y me perdonarás, Pero al principio he citado los colaboradores de este webinar. Les quiero agradecer un poquito más en detalle. Estamos en el Meliá Castilla, auditorio increíblemente equipado. Hospitalidad de primera, que cuando toses tienes alguien que te trae agua. El programa Stay Safe with Meliá, que permite una seguridad sanitaria considerable. Un ancho de banda enorme, 4 gigas aquí y 10 gigas hasta afuera. Y simplemente un equipo absolutamente preparado para eventos muy exitosos. Y además están abiertos ahora y esperan vuestros eventos. Tenemos también... Tengo tos todo el año, no os preocupéis. Tenemos también otra que es joint venture entre Fluge y Crambo, 2 grandes empresas de audiovisuales. Otra que es la empresa para servir el sector hotelero, están aquí. Si sois un hotel, pues tenéis ahí un partner potencial perfecto, super equipos, hemos tenido una calidad de servicio de Rodrigo y equipo de primera, con lo cual gracias. Gracias a Meetmaps, que desde hace un año nos acompaña con sistemas de registro y con interactividad, y gracias a Watchity por la conectividad. Y gracias al equipo de Evento Plus con Cristina, con 2 Cristinas moviendo los hilos. En serio, enorme agradecimiento. Ahora te doy la palabra y veo que el doctor Jorge Contreras está aquí, con lo cual bienvenido, doctor, y gracias por unirse.
Buenos días, un placer.
Buenos días. ¿Cuál ha sido el proceso? Y luego me interesará preguntar al doctor qué importancia tiene esto en la estrategia de la SEOR, que es la sociedad local, digamos, correspondiente a esto.
Bueno, muchas gracias. Primero, voy a intentar explicar cómo se ha hecho esto posible y qué es el legado Madrid 21. En noviembre del 2018, Madrid Bureau contacta conmigo. Yo soy oncólogo radioterapeuta. Contacta conmigo porque esto había ofrecido la posibilidad de realizar una candidatura en la que expusiéramos un legado para la ciudad de Madrid, con la finalidad de que no solamente la parte técnica de lo que Madrid cuenta para ofrecer y ser sede de un congreso, sino qué parte podíamos aportar como sociedad médica para que el congreso viniera a nuestra ciudad. En ese momento colaboramos Madrid Bureau y en un momento inicial yo misma, y pensamos cómo construir un legado o un proyecto a partir de la nada. No había ningún precedente, no teníamos ningún tipo de manual que seguir y, por tanto, lo primero que hicimos es pensar en qué punto estábamos. Teníamos 2 tipos de información, una que venía de la Sociedad Europea, de ESTRO y de SEOR, que decía una información muy concreta, que era que España, comparado con otros países de la Unión Europea, tenía mucha menor accesibilidad de los pacientes a la especialidad. Es decir, comparativamente con otros países de Europa teníamos un problema. El paciente que requería tratamiento de radioterapia tenía menos acceso. ¿Por qué? Porque había menos máquinas, digamos, menos unidades de tratamiento comparativamente con otros países de Europa. Y segundo, además, había menos especialistas formados. Esto era una información que teníamos. Y la otra, de la que yo me nutrí para construir con el resto de compañeros el legado, fue primero cómo me veía yo, no como médico, sino si yo fuera un paciente, si estuviera sentado al otro lado de mi mesa, cómo veía yo mi especialidad, cómo transmitíamos los oncólogos radioterapeutas nuestra especialidad al gran público. Esto fue la parte más importante del legado, es decir, lo que nos dimos cuenta y lo que sabemos es que no hemos sabido transmitir, no hemos sabido comunicar, no hemos sabido mencionar lo que hacemos, para qué servimos, qué es nuestra especialidad en un lenguaje claro, y no solamente al público en general, sino también al resto de especialistas no relacionados con la oncología. Si yo a cualquier persona pregunto qué es la oncología médica, todo el mundo lo sabe, sabe los efectos de la quimio, pero cuando hablamos de radioterapia no. Y ahí, con esas ideas que teníamos muy bien sustentadas, se empezó a construir el legado. El legado constituye una solución o pretender dar una solución a todos estos problemas que he dicho, que he puesto sobre la mesa. El primero, vamos a empezar por la parte segunda, era cómo ser más visibles, y esto Jorge explicará perfectamente parte de nuestro proyecto. Y básicamente mi posición fue: ¿qué podemos hacer para ser más conocidos y para ser una fuente fidedigna de información? Y ahí empezó la página web. La página web es una página inforadioterapia.net o .es, en la que exponemos abiertamente, con un lenguaje muy claro, con un lenguaje muy sencillo, todas las partes que comportan un proceso de radioterapia, desde qué es, para qué sirve, cuáles son los efectos, cómo me voy a sentir, cómo es un médico que me va a tratar, quién me trata, dónde me trata, qué aspecto tiene, qué efectos voy a tener, cómo me tengo que lavar, qué tengo que comer, cualquier duda que uno tenga relacionado con la radioterapia. Este fue una de las patas que nosotros sustentamos para nuestro legado. Otra muy importante era comunicar, y comunicar no solamente a los especialistas médicos, que también, sino también al público en general. Las medidas eran comunicar a otros especialistas, comunicar a estudiantes de medicina, comunicar a niños que todavía no habían acabado, que estaban ya en los últimos años de formación y que tenían que elegir una especialidad, comunicar al público. Y todas estas medidas que nosotros teníamos muy claras, de repente, todos sabemos que hace un año llegó la pandemia, y todo lo presencial que nosotros teníamos y que teníamos muy elaborado y muy pensado, de repente se truncó. Por tanto, este legado además ha tenido que repensarse durante toda la pandemia y reforzar aquello que podíamos hacer en ese momento, que era la parte de la página web. La página web para nosotros ahora mismo es el core de toda la estrategia de legado que queremos hacer, puesto que durante un año prácticamente no hemos podido, obviamente, comunicar, y seguimos sin poder comunicar presencialmente, y por tanto ahora con la aportación de Jorge hablaremos de cómo, a partir de lo que en principio considerábamos que era un problema, hemos conseguido que sea no solo un problema, sino que hemos reforzado y mejorado aún más este legado. Había una tercera pata que para nosotros era muy importante para este legado, era comunicar y transmitir a nuestros políticos. Nosotros, como especialistas en radioterapia, no podemos decirle al Estado, a nuestro gobierno, que ponga más máquinas de tratamiento de radioterapia para alinearnos con el número de máquinas que tiene que haber o el ratio necesario para tratar bien a nuestros pacientes. No podemos decirles que formen más médicos especialistas en radioterapia, pero sí podemos comunicar, sí podemos interaccionar, sí podemos manifestar nuestro entusiasmo y cuáles son las posibles soluciones para hacer que este legado no solamente se quede en Madrid 21, sino que, como pretendemos, continúe en los próximos años. Tenemos una labor inmensa que acaba de empezar.
Vale, vamos a ir al doctor Contreras. Antes de esto, no sé si puedo dar la cifra, con lo cual no la voy a dar, pero en la entrevista con Alessandro me dijo que lo que estaban midiendo no es una noción abstracta de conocimiento, etcétera, sino que son muertes evitadas, con lo cual palabras mayores, ¿no? El legado no es pintar una escuela, es salvar vidas, ¿no? En vuestro caso es algo muy importante, ¿no? Vamos a ir después a David para entender cómo el Madrid Convention Bureau ha tratado esto. Doctor Contreras, buenos días, gracias por estar aquí. ¿Cómo definiría la importancia estratégica de lo que está pasando, o de lo que va a pasar en lo que está pasando ahora y pasará en agosto y pasará después de agosto para la SEOR?
Nada, muy buenos días. Yo creo que Natalia lo ha resumido muy bien. Nosotros desde SEOR es una sociedad científica que representa a los oncólogos radioterápicos españoles, estamos muy concienciados de la necesidad de que un tratamiento tan eficiente tan efectivo y a la vez tan, digamos, desconocido, pues se pudiera hacer, digamos, llegar a todo lo que es la población en general. Nosotros partimos de una base muy importante, que yo creo que es importante recalcarla, de que más del 65% de los pacientes oncológicos van a necesitar radioterapia durante todo su proceso. Pero lo que es más importante, hasta un 40% de pacientes oncológicos se pueden curar con el tratamiento radioterápico. Y sin embargo, nosotros desde SEOR hicimos una revisión de cuál era el grado de utilización de la radioterapia en España, junto con una universidad, Francisco de Vitoria, y salió una cifra en comparación con otros países de nuestro entorno europeo de que más de un tercio de los pacientes que se pueden beneficiar de la radioterapia no la estaban utilizando por dos motivos. El primer motivo por falta de recursos, como ha comentado la doctora Carballo, que básicamente se ha venido a paliar un poco por la, digamos, incorporación de los recursos de radioterapia por la donación de la Fundación Amancio Ortega, pero por otro lado, muy importante, por una falta de visibilidad de lo que es el conocimiento del tratamiento radioterápico y de sus ventajas, como ha comentado Natalia. En ese sentido, la sociedad científica SEOR no es más que una herramienta que se pone a disposición de los profesionales para que desde el punto de vista de la utilización de esa herramienta se pueda conseguir llegar al mayor número de pacientes por el beneficio de los pacientes. Y eso es básicamente lo que ha hecho que se alineen todo lo que son los intereses tanto de ESTRO como de SEOR para que en España, haciendo una campaña de visibilidad, una campaña que nosotros hemos puesto en marcha desde SEOR denominando invisible, que queremos pasar, digamos, de ser una especialidad muy poco conocida y poco demandada, tanto por la sociedad como por los profesionales, a una situación de visibilidad. Y esto, con todo el proyecto y con la colaboración tanto del Convention Bureau como de ESTRO, puede ser perfectamente puesta en marcha y nos va a hacer que podamos estar al nivel del resto de los países europeos. O sea, que en este sentido creo que ha habido una alineación de planetas que nos ha permitido que diferentes actores, teniendo el mismo objetivo, podamos luchar por conseguir lo que en definitiva es un beneficio para la sociedad con una, digamos, mayor visibilidad de los profesionales. Un poquito esto es lo que yo creo que se puede plantear.
Perfecto. Dos preguntas rápidas. Una es, todo esto se podría hacer sin el Congreso, pero el Congreso es una manera de llamar la atención y de comunicar la importancia de vuestra disciplina, que hace que todo el ejercicio sin Congreso sería mucho menos eficiente que con Congreso. Captar la atención de los políticos o de las universidades con un Congreso es mucho más fácil que simplemente decir siempre hemos estado aquí y ahora os contactamos.
Sin ninguna duda, porque nosotros como profesionales tenemos que reconocer y entonar el mea culpa de que algo no hemos hecho bien. Tenemos una herramienta súper efectiva, súper eficiente, cura un 40% de los pacientes. En España se dedica de todo el presupuesto global del cáncer un 5% a la radioterapia, curando un 40%. Nosotros algo hemos hecho mal cuando no hemos sabido llegar ni a los gestores, a los políticos, ni a la población en general. Entonces, obviamente una oportunidad como digamos, apoyo de una sociedad europea con una serie de recursos, de acuerdo con el Convention Bureau, en la oportunidad de hacerlo en Madrid, nos permite conseguir esa visibilidad y llegar a áreas donde nosotros de forma individual no podríamos hacerlo, por lo cual es una oportunidad absolutamente única.
Vale, perfecto. Y la segunda, hay un Congreso Europeo de Radioterapia Oncológica este año en Madrid, pero lo que está pasando lo ve como el inicio de un periodo bastante largo en el cual todo esto vivirá. ¿Va a dejar huella duradera, digamos, esto?
Correcto, es que esto básicamente era lo que inicialmente se planteó cuando nadie podía prever que iba a venir una pandemia y que iba a, digamos, a colocarnos en todos los proyectos. Pero lo que sí que es cierto, que como Natalia también ha ido comentando, nosotros nos hemos ido adaptando para que esto no sea un impacto, sino que sea un legado, digamos, inicio de una campaña de mayor visibilidad que se va a ir potenciando y que desde la sociedad nosotros en SEOR lo vamos a ir manteniendo y aumentando en los próximos años. No es algo puntual.
Perfecto. Voy a David, recuerdo que podéis hacer preguntas, las preguntas que se han hecho en la primera parte yo creo que las hemos contestado, que me las han traído. Podéis hacer preguntas a través del chat. David, felicidades por esto, felicidades por Lung Foundation, que es el caso de Pipa. Felices por ser el primer destino que conozco que tenga un responsable delegado, que es Jorge Treceño. Ahora, tu punto de vista, tu experiencia, y a qué punto ves esto como algo transformador para el Convention Bureau también.
Pues buenos días, Eric. Buenos días, Natalia. Para nosotros, en el tema del impacto positivo, como dice Alessandro, o del legado, el ejemplo de esto ha sido, yo realmente lo definiría como un regalo. Nació como un reto muy complicado, porque obviamente quizá de los congresos médicos es de los más desconocidos, como decía la doctora Carballo, y para nosotros plantear una candidatura en esas condiciones era muy complejo. Pero también veníamos de una rotación entre dos ciudades habían estado rotándose ese congreso durante mucho tiempo y teníamos la oportunidad de que Madrid pudiera entrar ahí, y por tanto entendimos que había que hacerlo. Pero si escuchamos de los últimos 10 minutos de esta conversación, de turismo no se ha hablado de medicina, y por tanto es lo que hemos tenido que hacer, aprender. Un informe que publicó SEOR poco antes del proceso de candidatura nos ayudó mucho a sentar las bases de cuál era la situación de la radioterapia en España. Obviamente contar con el apoyo de la doctora Carballo fue fundamental, porque si no, no habría opción a presentar una candidatura, pero su entusiasmo y nuestro deseo por hacer cosas nuevas, pues creo que nos sirvió para presentar una candidatura convincente. Pero digo que ha sido un recorrido de aprendizaje que nos ha sentado las bases para que creo que empecemos a hablar de legado, no solo en Madrid, sino en España, y que también dotemos un poco de recursos, porque esta candidatura obviamente lo que Madrid aporta es un poco esa plataforma, son los recursos, porque hay una serie de acciones que debemos que hacer, y por supuesto luego, esto es un ejemplo muy claro, es un case study de libro, porque encontramos a nuestro embajador, contamos con el apoyo desde el primer momento de la Sociedad Nacional, que es SEOR y es su presidente, y por tanto cerramos el círculo. Creo que es un ejemplo de colaboración, en este caso a tres bandas, y con Estro como demandante de esta acción, y esperemos que se cierre no solo con el Congreso en agosto, sino con ese impacto positivo posterior, porque la web, como se ha comentado, pretende ser una herramienta en el tiempo que permita pues dar información sobre esta tipología de...
Vale. Vamos a dar la vuelta ahora, a dar el cambio a las asociaciones, sociedades médicas. Se ha comentado antes que muchos destinos piensan en habitaciones y no en la misión de la sociedad médica. De tu lado, los briefings o los pliegos que recibes tienen esta noción. Héroes o heroínas como la doctora Carballo, hay muchos, porque entiendo que necesitáis esto, no podéis hacer el legado vosotros solos. ¿Cuál es tu opinión de la madurez o del desarrollo de esta noción de legado impacto en las sociedades médicas y en sus procesos de selección de destinos?
Yo creo que el caso de Estro es excepcional, en cuanto a que lo tienen clarísimo en su visión y en su misión. No todas las candidaturas todavía son así. Nosotros lo que estamos haciendo desde el Convention es ser proactivos, y en los procesos de candidatura ofrecemos participar, colaborar con la sociedad para implantar, si no lo ha hecho todavía, un proyecto de impacto positivo o de legado, y por tanto intentamos ser esos catalizadores, pues que en algunos casos pues creo que podemos decir que nos ha permitido que un congreso nacional o europeo que no se planteaba hacer una acción de impacto positivo en la ciudad, ahora sí lo esté haciendo, porque nosotros pues le hemos puesto en sobreaviso de esa circunstancia y le hemos ofrecido nuestro apoyo, obviamente.
Vale. Perfecto. Doctor Contreras o doctora Carballo, ¿esto lo aplicaréis en vuestro Congreso Nacional? Es que los pocos ejemplos de legado maduros que hemos visto, primero son pocos, como ha dicho David, y suelen ser de sociedades internacionales. ¿Hay algo que hace más difícil aplicar lo mismo al Congreso Nacional? ¿Lo aplicaréis? ¿Es más difícil hacer ruido si es un Congreso Nacional que si es un Congreso Internacional? ¿Cuál es vuestra opinión? ¿Lo aplicaréis?
Obviamente, si quieres, Natalia, contesto yo en relación al Congreso Nacional nuestro. Vamos a ver, yo esto lo veo como un conjunto. Esto es algo que es, digamos, continuado. Nosotros en el Congreso Nacional, por supuesto, que vamos a hablar de lo que es el legado Estro y vamos a hablar de lo que es la campaña de visibilidad. Y es un continuo que se va a utilizar para plantear pues, una necesidad básica de presencia y de conocimiento por parte de la sociedad y por parte del resto de los profesionales de lo que es la radioterapia. Por tanto, obviamente, todo lo que se va a hacer en el Congreso Estro se va a continuar en el Congreso SEOR que haremos posteriormente después de verano y en el que va a haber una continuidad de todo lo que es el mensaje legado esto.
Perfecto. ¿Algo que añadir o vamos al proceso de trabajo? Porque me interesa mucho saber en este ménage à trois entre sociedad local, sociedad europea y Madrid Convention Bureau. Lo siento, soy francés. ¿Cómo? Es horrible eso lo que acabo de decir, os pido perdón. ¿Cómo ha sido el trabajo? ¿Se monta un equipo de trabajo desde el principio de la candidatura? ¿Quién forma parte de esto? Está el Convention Bureau, pero no sé si están otros actores del ayuntamiento o de la comunidad. ¿Alguien me puede describir un poco cuál ha sido el proceso de trabajo?
Bueno, el proceso de trabajo, como ha dicho la doctora Carballo, nace en las oficinas de Madrid Convention Bureau con la participación de la doctora. Conjuntamente planteamos una candidatura, nosotros la parte que nos correspondía y ella la parte científica, y pues bueno, prosigue con la confirmación de que Madrid ha sido designada como ciudad que albergará el Congreso. Posteriormente, siempre a través de nuestro embajador, por decirlo así, pues contactamos con la sociedad española y es cuando se produce un poco ese trabajo ya o ese grupo de trabajo en el que, pues ciertamente Convention Bureau, representando al Destino y la Sociedad Nacional y la doctora Carballo, planteamos un poco las líneas a seguir a partir de ese momento.
Vale. Digamos solo que añadir que primero se establecieron las líneas en las que debíamos trabajar y luego se han incorporado los actores que han ido enriqueciendo esas líneas que inicialmente empezó en su despacho como vamos a presentar un proyecto y vamos a ver qué pasa con estas ideas que hemos puesto sobre la mesa. Es decir, el proyecto ha ido enriqueciéndose conforme ha ido pasando el tiempo y conforme también hemos visto que la situación de la pandemia ha ido apareciendo. Y sin duda alguna, el proyecto que puede ser fruto de la idea o de la visión de dos personas se ha enriquecido enormemente porque la visión de la sociedad, de SEOR, de la sociedad médica, está en absoluta sintonía con la de la ESTRO y con la de todos. Por tanto, esto no ha hecho más que mejorar y enriquecer un proyecto que todos hubiéramos querido acometer y que posiblemente si ESTRO no hubiera venido a Madrid no hubiera tenido tanta visibilidad como la que va a tener.
Y si me permites, Eric, claro, tú lo decías al principio, nosotros desde hace, pues eso, casi 2 años o más, hemos querido apostar por esto. El ejemplo, y si tú lo has mencionado, es que tenemos una persona en la oficina, Jorge, que es quien, a fin de cuentas, está en ese grupo de trabajo con la sociedad, con la doctora, y dando apoyo a otros muchos congresos dentro del departamento de congresos, y si no dando apoyo, sí incentivando a que otras sociedades empiecen a pensar en hacer ese tipo de acciones. Por lo tanto, sí creo que hemos querido ser proactivos, creo que lo estamos demostrando, y bueno, hoy estamos hablando aquí de legado, ¿quién lo diría con Evento Plus? Cuando realmente tu audiencia es otra o tenía otros intereses, y hoy estamos hablando aquí de legado.
Fíjate que, perdón.
No, sigue, Natalia.
Que la articulación es todavía un poco más compleja porque además la persona que se dedica al legado de Madrid Bureau y yo misma tenemos un interlocutor en ESTRO, con lo que también articulamos que en cada momento se van cumpliendo los puntos que queremos acometer, y lo más importante que no debemos olvidar es que se va a medir ese impacto. Es decir, para nosotros todas estas acciones que se van a poner en marcha son importantes porque también tenemos herramientas para medir ese impacto, que para nosotros, junto con Madrid Bureau y SEOR y ESTRO, es casi lo más importante de todo el proyecto, acometerlo y medirlo.
Hablando de medición, creo que Alessandro me comentó que suelen ver el impacto a 3 años o algo así. Es decir, no hablamos de ir a hacer algo y hacer una pregunta, sino realmente de un proceso, lo cual supongo que permite que todo esto sea mucho más efectivo porque se toma el tiempo de ver cómo se desarrollan las cosas. ¿Eso son 3 años?
Sí, en este caso concreto, como estamos teniendo, para ir a lo concreto, a una respuesta de cómo medir un impacto o una de las formas, como tenemos una página en la que no había visitas porque es nueva, creación cero, todo lo que son las entradas y todo lo que son las consultas ya nos ofrece una forma de medir objetivamente, porque hay otras muchas opciones que teníamos de presencial que evidentemente no podemos hacer ni medir por cuestiones obvias. Por tanto, efectivamente, la medición no solamente se queda en agosto, que es cuando se celebra el congreso, sino que tendrá un recorrido mayor.
Perfecto. Doctor Contreras.
Sí. Yo simplemente quería añadir que como tercera pata, SEOR, insisto, es una herramienta a disposición de los socios para iniciativas que le den visibilidad y que le den recorrido a la oncología radioterápica. Entonces, en ese sentido, como ha dicho David y como ha comentado Natalia, se han alineado 3 patas para conseguir un objetivo común. Y en ese sentido, nosotros en SEOR estamos absolutamente contentos y orgullosos de poder ayudar y colaborar en este proyecto.
Perfecto. Tipos de recursos. En general, el Convention Bureau está en contacto con los hoteles, con el centro de convenciones, etc. Entiendo que con esto cambiáis un poco de stakeholders, ¿no? de personas que intervienen. ¿A quién habéis implicado? Hablamos de la delegación de salud, por ejemplo, de la ciudad, hablamos de prensa, hablamos de universidades, ¿a quién habéis implicado vosotros? Porque creo que cada Convention Bureau mañana tendrá que tener esta capacidad de decir, pues no solo te busco un hotel, sino que te busco un centro de investigación o lo que sea. ¿Con quién y si ha sido fácil como Convention Bureau acceder a...?
A ver, creo que también como Convention Bureau o como oficina de congresos adscrita al área de turismo, también tenemos que tener claro dónde está nuestro límite. Y por tanto, por eso queremos que los temas sanitarios, en este caso, lo aborden los profesionales y que no haya una intromisión en donde no nos corresponde. Por lo tanto, nosotros lo que hemos hecho ha sido dar soporte, en este caso a SEOR, para que sea SEOR quien, si hay que interlocutar con administraciones o con consejerías de sanidad, lo hagan ellos, y no nosotros como oficina de turismo. Por lo tanto, es dar soporte en aquellas partes que afectan a la ciudad, lo haremos nosotros, pero sin entrar en el campo que no nos compete. Porque creo que ahí sí que tenemos que ser muy cuidadosos. Y por tanto, es SEOR quien pues está planteando la acción de legado que se tiene que hacer. Nosotros la estamos apoyando, pero son los profesionales, en este caso, en el ámbito que afecta, quienes deciden por dónde tenemos que ir.
En el ámbito sanitario, en otros ámbitos, prensa,
nosotros,
por ejemplo, ¿ayudáis? ¿O
claro,
que mañana
hay una relación, un documento de acciones conjuntas que vamos a llevar a cabo, que hemos tenido que ir adaptando porque no hemos podido hacer, como ha dicho la doctora Carballo, acciones presenciales. Llegará un momento en que haremos una rueda de prensa conjunta, se presentará de manera conjunta, porque obviamente, y la página web que se ha mencionado, nuestro logo está, porque somos copartícipes, y por tanto daremos soporte en las distintas fases, como hemos hecho, por supuesto, en otras candidaturas.
Perfecto. Una más para ti antes de volver al campo sanitario. Has trabajado en el Spain Convention Bureau, conoces bien los ayuntamientos y los Convention Bureaus, con lo cual esta pregunta no es solo para David como Madrid, sino para David en general. ¿Cómo crees que los ayuntamientos en general ven esto? ¿Lo entienden? ¿Les puede entusiasmar? ¿Les puede hacer ver el sector de eventos como algo mucho más importante a nivel social, sanitario, económico? ¿Es transformador para ti?
Es un proceso muy lento y, como yo digo, aunque llevemos un poco 2 años, octubre de 2018, pensando en legado, en impacto positivo, seguimos aprendiendo y nosotros tenemos recursos. Por tanto, creo que es una idea que a todos interesa, no es fácil. Y se ha hablado antes de la diferencia entre RSC, de la que se habla hace mucho tiempo, y de impacto positivo, de lo que no se habla prácticamente desde hace nada, y por tanto ahora mismo es un aprendizaje. Interesa sí o sí a todos, y creo que se puede trasladar también a nivel nacional. Podemos colaborar con las sociedades españolas, a que esas sociedades en sus congresos integren acciones de impacto positivo, y como se ha dicho por Isabel, creo, lo que tenemos que tener claro como destino es cuál es la misión y la visión de la sociedad, entenderla y ser proactivos a la hora de ofrecerles propuestas para que en su congreso integren acciones que permitan poner en valor su misión y su visión.
Vale. Doctora, doctor, vuestra opinión sobre este tema. ¿Es efectivamente transformador? ¿Los destinos que conocéis os parecen estar mirando en esta dirección o queda trabajo? y os sentéis entendidos. En la primera parte las sociedades decían un poco, necesitamos que los actores locales, convention bureaus y proveedores piensen un poco más en nuestro objetivo que en sus habitaciones. ¿Cuál es vuestra valoración de este tema? ¿De a qué punto esto puede ser transformador y una fuerza de mejora para todo el sector y el entendimiento de vuestra misión? Es una pregunta de 22 minutos, lo siento.
Si me permite, Natalia, vamos a ver, yo creo que David lo ha comentado antes muy bien. Cada uno tiene que hacer su papel para que esto consiga el objetivo que buscamos, ¿no? Que es pues una mayor visibilidad con una mayor, digamos, proyección ante la sociedad. Entonces, obviamente, nosotros como profesionales, como científicos, sabemos perfectamente cómo organizar y cómo orientar las reuniones para que desde el punto de vista científico sean atractivos, pero luego hay una parte muy importante de relación social, hay una parte muy importante de contacto personal, que en estos momentos está limitado, pero que es algo, digamos, que es objetivo fundamental de un congreso. Entonces, y esa proyección sobre la sociedad y esa parte social, esa parte organizativa, obviamente nosotros la tenemos que dejar en manos de los profesionales que son los que saben manejar este tipo de situaciones. Por tanto, nosotros desde la sociedad, encantados de que planteando todo lo que sería el evento científico con los intereses desde el punto de vista de proyección de imagen de la radioterapia, a partir de ahí, obviamente todo queda en manos de lo que sería los profesionales que organizan el evento, ¿no? En ese sentido, yo creo que es muy importante diferenciar el papel de cada uno de nosotros para que cada uno haga su papel.
Perfecto. Un
Nada
complemento. Vale, llegamos al final de la sesión. Yo os quiero agradecer a todos. Ha sido entusiasmante tanto la primera parte como la segunda. Felicidades por hacer lo que creo que va a ser el caso más potente hasta la fecha de legado, o de legado de impacto, no sé cómo lo llamamos. Doctor Contreras, mil gracias por unirse a nosotros. Doctora Carballo, David Noack, mil gracias. Hermelia Castilla de nuevo, OTEC de nuevo, Meetmaps y Watchity han hecho un gran trabajo. Cristina a nivel de regiduría. Y yo creo que el mundo va a ser muy pronto un mejor sitio gracias a los eventos y eso es gran noticia. Mil gracias.